Hello everyone, I am Dr. Taruna Suthar. Today I am going to talk about the phobia. What exactly the phobia is, what do you mean by the phobia, and what are its treatment and the preventive measures. The word phobia derived from the Greek word that is the god of fear, that is phobos, which means fear, panic, dread and fright. Actually, the phobia is a consistent and disproportionate fear of some specific objects or situation which in reality represents no actual danger to a person. When a phobic individual encountered to a real frightful situation, the person himself experiences a fight or flight responses which prepares a person to escape from the situation. So physiologically and behaviorally, the response of a person, of a phobic person, is identical to the response of a person who actually encounters with the real terrifying situation. So in reality, the people who have the phobic disorders, they know exactly what they are being afraid of, except for some specific objects, persons or the situations. The phobic individuals usually do not engage in the gross distortions of the reality. Physiologically, nothing go wrong with them, only their fear is out of proportions with the reality and beyond their voluntary control. There are three main categories of the phobias have been mentioned. Number one, that is a specific phobia. Number two, that is a social phobia. Number three, that is the agoraphobia. In my forthcoming videos, we will discuss about the social and the agoraphobia. Today we are going to discuss about the specific phobias. Specific phobia is also known as a simple phobia. It involves the fear of some other species. For example, the snake and the spider is one of the commonest phobias which have been observed today, and other phobias are the fears of the height, water, tunnel and the bridges. So in the phobic patients, they do not need the real terrifying situation of the objects to have that intense discomfort or that terrifying phobic reactions. For example, the persons who are having the phobia of the airplane just might imagine that fear-provoking situation can also elicit that terrifying psychological response of the persons. We will discuss about the treatment measures for the phobic disorder patients. Nowadays, CBT, that is a cognitive behavior therapy, is mostly prevalent and used by the clinical psychologists, counselors and the therapists. But here we will discuss about the behavior therapy for the treatment of the specific phobias or for the treatment of the simple phobias. In this behavior therapy, it involves the controlled exposures to the environment or the situation that elicit the fear or the phobia. It is also known as a systematic desensitization, where we are going to train the persons or the individuals to have the deep relaxation training, and we are going to ask the persons to just make the hierarchy of the situation from the least fear-provoking situation to the most fear-provoking situation. So while in the state of the relaxation, now we are going to ask the patient to imagine the least fear-provoking situation to the most fear-provoking situation. In this way, the least fear-provoking situation begins to extinguishes. So in this way, we are going to train the patients that it is not the situation is as harmful or frightening as they have thought. So their fear or their anxiety is no harmful or no dangerous. If you have any queries or the questions regarding the phobia or any of your personal problems, please you can share and consult me. So please don't forget to like, share and subscribe my channel for the more and more awareness about all these problems. Jai Hind.